Okay, next trigger finger. The other name is Stenosing Tenosynovitis. This is the tendon. This is the tendon. And when this tendon swelling, there's a swelling over the tendon. So in our finger, there are many pulley, annular, A1, A2, A3, A4, A5. So in trigger finger, most common problem is the A1 pulley. Either the A1 pulley thicken or the tendon surrounding the A1 pulley swelling. So during the movement of the finger, the patient will have a triggering or the movement is not smooth. So the problem is the A1 pulley. So this is the pictorial example where this is the A1 pulley. Of course, the patient, most common presentation, they will have a pain over the palm and then swelling during examination. The finger movement is not smooth. It's a triggering. So it can be due to thickening of the A1 pulley or thickening of the tendon or swelling over the tendon. So conservative treatment, early presentation, I will tell them try to reduce intensity, frequency of certain activity, pain control, of course, painkiller, and topical application to reduce the swelling, and then splinting. But most of the patient not compliance with the splinting, but this is the type of splint you can get. It immobilizes the base of the finger joint, or we call MCP joint, metacarpophalangeal joint. It hold at the 10-15 degree to hold or prevent movement over the MCP, but allow the small joints movement. Why we do splinting? Less irritation. When less irritation, there is less swelling for a certain period. Next, corticosteroid injection. The steroid injection is given under local. It given surrounding the tendon sheath, and it will reduce the swelling. Less irritation, no blockage of the movement. Because steroid is very powerful tool. We use it quite frequent. A person with a very painful trigger finger directly to the tendon sheath. But of course, before we do injection, there are side effects of the steroids. Because steroids, we can reduce the thickness of the skin. Certain patients have this problem. This is another example. It will cause discoloration. If your complexity of your skin is darker, then you will get this complication. If the complexity of skin is brighter, you will have this complication, which is pigmentation. Sometimes it can be permanent, and some patient will be very upset. That's why we have to counsel the patient before doing something. Surgical only for patient with a severe pain, after despite painkiller, despite physiotherapy, extensively physiotherapy, still have the symptoms, then we recommend open surgical release. How do we do? The aim is to divide the A1 pulley, then no more friction. Infection, yes, common side effect. If you don't really take care of your wound, then you tend to have an infection, but it's very rare because it's a small surgery. Nerve injury, because there's a small fine nerve running to supply your finger, so which is we have to avoid during the surgery. And if the operator or surgeon did an incomplete release, then you will have a recurrence of symptom, which is very rare because the surgery most of the time quite straightforward. Bear in mind, some surgeon they will place a scar incision like this and like this, but the result is still the same. Probably the cosmetic effect is better in this type of incision.